I thought that we kind of got our arms around this and that we were doing pretty well with things until Omicron hit the East Coast. And I will tell you, just before Christmas, if you were trying to get a test anywhere, anyhow, it was nearly impossible. There was this huge surge that maybe we thought we wouldn't see again because of the vaccinations. And the government was given a lot of grief for the idea that they didn't do more to prepare. Where do we stand on testing right now? What can we handle? What can we not?
Well, first of all, the supply of tests is much better than it was. They're available from different home kits. Mm-hmm. Manufacturing is going up on that, and it's been ebbing and flowing based on demand. Yeah. And so I think that the fact that there were many more tests at home also attributable to the fact that people, would rather do that than go out and do it. And I think that's probably going to be the case going forward. People will keep a few test kits at home if they feel like they're expressing symptoms, and that, frankly, that's the right course of action. If you feel sick, it's a good idea to get tested. That way you're not going to expose other people. And it's just common sense.
Yeah, there have been some questions raised about it because if you test at home, the health department doesn't necessarily get the results, so maybe we're not tracking the numbers quite as clearly. But I will say, given where things went down just in the last month or so in New York City, if you didn't have test at home already, you were going to have a really tough time getting this. And by the way, if you want to go find out and stand in a line like we were seeing at that point, if you didn't have COVID before you got in the line, you might by the time you got out of it.
So interesting. Excuse me. We had 60 million vaccinations given, 30 million tests. So tests were lagging vaccinations because once people figured out, I get the shot, I get the second shot, I get the booster, that seems to protect me. And obviously we're talking percentages here. The highest percentage of people who've gotten 3 shots haven't gotten sick with COVID, even with breakthrough cases, minor symptoms. The testing piece is so critical to slowing down spread unnecessarily.
When does it become where the testing is just not even worth doing? And I'm not listening to Joe Rogan. I'm seeing it on mainstream places now about things happening in the UK, about where we are in terms of if you add up vaccinated with people that have had Omicron, with people that have had Delta and Omicron, and you get up to a certain number, if you do the calculations on what the morbidity rate is now, it's getting similar, maybe slightly above the flu. But when do you get to the point where you just say, all this testing is, we don't need to do it anymore?
You're answering your own question. The whole thing of herd immunity and endemic, this is becoming endemic quickly.
Although Scott Gottlieb said it doesn't happen until the hospitalization system isn't strained. Like, that's the question.
Yeah,
for them,
I'd say that is the single thing that people worry the most about is being able to treat. But Joe, I think we're really close. That people are going to realize, hey, this is not going to make me gravely ill. I weather it in a few days. I mean, of course, we've all heard of people with breakthrough cases, but we're talking tiny fractions. And so I think we are on the, if we're not already.
Everybody gets it who had three. The Omicron, you get it, but it's sniffles for, hopefully.
If at all.
Right, hopefully. But
we got to be close. And I think the government is being uber cautious about making policy statements about it, because what happened with the last 6 policy statements they made. We can't outguess this thing. Right. And, of course, there's always a chance that there's some new variant.
Yeah.
What did the vaccination program in this country mean just in terms of new customer acquisition for you? Because everybody went to a pharmacy, drugstore, and you guys were getting a lot of those people coming in.
Well, the numbers are stunning. We have 21 million visits to the stores a week, even during the pandemic, because you went there for testing, or maybe you went there for the shots. 60 million vaccinations. Most of those performed in the store, some cases in kiosks or separate areas in the minute clinics. But everything, virtual care visits, in-person primary care visits, our business was shifting before the pandemic began doing more services, and all that the pandemic did was push it much faster.
Do those customers stick around? Do you retain them? Do they buy things at the front of the store too?
Yes. I mean, it's been an amazing year. We had to hire over 45,000 people just in the front store, but we also added doctors, nurses, other kinds of practitioners. Here testing here at the AT&T.
Shepard Smith here. Thanks for watching CNBC on YouTube.